out that, the meetings were a bit different, the conversations were different, a bit more, if I may use the word structured, but I don't go structured with agenda, the way we do
Right.
deliverables and agenda and all, but roughly kind of nicely guided.
Welcome to the International Institute for Facilitation's podcast, Spaghetti on the Wall. I'm Eileen Dowse, Chair Emeritus and Director of Assessments for INIFAC. And today I'm joined by a very good friend, Prabu Nadu, who's a certified master facilitator and one of the co-founders of the Facilitator Network in Singapore. And today we have, I think, a very interesting and perhaps a unique topic that you may not have thought about as a facilitator. The topic we're going to untangle on this Spaghetti on the Wall podcast today is key facilitation skills used by patient advocates. So welcome, Prabu.
Thank you, Eileen, and thank you for giving me this privilege to have this conversation with you. I enjoy having such conversations with you.
We always
Opens
have
up
a good time. Yeah. Prabu, in the spirit of untangling things, could you untangle for me the difference between patient engagement, you can tell I'm a facilitator, patient engagement, patient partners, and patient advocates? Because today we're talking about patient advocates. What is the difference in all of these?
Sure, Eileen. Thank you. So this is my interpretation of the definition, and I think there could be variations in the definition, but as I have understood so far, in the case of a patient advocate or patient advocacy, it would be equivalent to like the voice of the patient. So when healthcare institutions and healthcare providers, healthcare teams work on their patients, the idea here is to also include and involve the patient. So in other words, patient is part of that multidisciplinary healthcare team, although the patient is the recipient of the healthcare. So involvement of the patient, from the very beginning, diagnosis or preventive education, health education, all the way to clinical procedures and clinical intervention that needs to happen. Yeah.
At this point, someone might be thinking, why are you talking about healthcare in facilitation? So you are a facilitator. How did these two things merge together for you with healthcare and facilitation?
Thank you, Eileen. So this question is very close to my heart. I've been a facilitator, practicing facilitator last 22 years, after being certified and all, and prior to that in the corporate world. So that's my domain. And then about 6 years ago, I was diagnosed with colorectal cancer, and of which I went through the entire treatment and all. And now I'm in remission. That's the good news. And in that life experience of mine, lived experience of mine, the last 6 years, I realized that as a patient, as a survivor, and fellow, there are other patients and survivors that I interact with in the support groups.
Yeah.
I realized that the skill sets that a well-trained facilitator, skilled facilitator, can bring in is of tremendous help. And I can talk about that, after this. So, but why these two? Because of my own lived experience.
You are always such a gift giver. So here you are going through your own experience and realizing that you also have these skills to move forward and help others. So from the standpoint of using facilitation skills to advocate, to be for advocacy, for patient advocacy, what does that look like? What behaviors do you start seeing as a patient advocate using facilitation skills?
Sure. Thank you, Eileen. Very interesting because, in group process facilitation, we say that the facilitator is content neutral, right?
Mm-hmm.
It's the participant that matters, right? It's their
Right.
content. We kind of manage the process.
Right.
In some ways, that applies to in this situation. As a patient advocate or advocacy for patients, it's not about getting into a them and us situation and taking up arms against the healthcare team and going into a kind of almost like a battle them and us stuff. It's not
Yeah.
between the healthcare providers and the healthcare recipients. It's more of us. Can we come together to operate as one for the benefit of the patient, right? And this includes family members and caregivers, the entire,
Oh, wow.
stakeholders,
Wow.
right? So the point here is, in order to do that together and not as adversaries, but as collaborators, it brings us smack naturally into our group process facilitation skill sets, isn't it? Competencies, right? Remaining neutral, looking at the bigger picture, involving the participants, hearing their voice. So replace participant with patient, and we have it. And intuitively, you did that when you did the opening of the podcast. You used the word participant instead of patient, and then you said patient. So it's so intuitive, you see. Yeah. So that's how that's what it is.
Thank you, because I think I'm finally understanding this now. And one of the things that you said that I really like this arms against the healthcare team. I mean, when you are not feeling well, I can't imagine trying to get information that makes sense to help you in this big picture. So, on that note, what are some of the frustrations or I don't know what the word would be, the bubble up for patients? I mean, we know someone must be fearful, they want information, all those reasons. So what kinds of things, what kind of behaviors bubble up so that these folks would do arms against the healthcare professionals?
Sure. So, conventionally, and I think this is applicable, in all parts of the world, but specifically so in the context of Singapore, um, it's quite easy and quite common to hear first either patients or their family members, uh, you know, feeling very concerned about the care plan, the treatment plan, all right? It could be an outpatient who is just coming in for regular visits once a month or once a quarter, or it could be somebody who is already warded in the wards, right? Whichever, that's this concern. Am I getting the right treatment? Should I be worried about this? What does this particular diagnostic test tell me? What are you, the doctor, the clinician, not telling me? Yeah. So this is very common. And one of the things we attempt to do in patient advocacy is to highlight to the clinicians, the caregivers, that they need to be receptive and open to questions like that from the patient and the family members, not because they are challenging your authority or your training, right?
Right.
But because that's how emotionally they are feeling, right?
Yeah.
And then we are also telling the patients, be aware that the clinicians and the healthcare have got a lot on their plate,
Yeah.
and a lot, plenty. So we need to be empathetic towards them too. So then that's one of the first messages, Interestingly, with one of the health institutions in Singapore, we created a care pledge, which has got a left column and a right column. So if I'm not using the exact words, but if it says respect, then we verbalize, on one column is from the healthcare provider perspective, and the other is the healthcare provider recipient perspective. And then the word respect is the same. It's two sides of a coin. So, we have done that, and we call it the care pledge in that particular institution in Singapore, healthcare institution. So like that, we communicate.
As you are speaking, Prabu, certainly I'm understanding more, so I thank you for that. And
Sure.
it's also making me realize how valuable knowing facilitation skills are in every component of life or industry or whatever. And I'm biased. I know you are too. Singapore, Prabu, you mentioned you're from Singapore. So is this patient advocacy only in Singapore?
No, Eileen, interestingly, we are learning now and because in the US there is a big movement. They were leading the pack, right, on patient advocacy, patient in different names being used, patient involvement, patient advocacy, patient participation. In fact, right now, and even through the World Health Organization, there's a phrase that's being used called patient public involvement.
Oh, wow.
PPI. Yep. And in Europe too, some of the countries have adopted and practiced, and Singapore now wants to do that in Asia, so that we could then be an example for the rest of Asia on this way of life principle of collaborating in the healthcare
So
sector.
if I try to do a parallel thinking here, I know that sometimes when I go into organizations and do my best to, I want to use the word convince, but I don't want to use the word convince people that they really do need a facilitator. Sometimes those folks in those organizations are receptive and some aren't. How receptive are healthcare workers, providers, to this concept of, hey, I'm going to help facilitate conversations and engagement between you and the patient?
Thanks, Eileen. You're right. Very well recognized. You have recognized it very well. Firstly, there are, like in any of such attempts of us practitioners to share with others about facilitation and the benefits of facilitation and all, there will be some who are early believers, early adopters. They can see the value of it, and there will be some who are skeptical, and we could be the late followers to catch up. In my own case, I identified. So I'm in like 3 patient support groups, different support groups in Singapore, and I volunteer with them. And I identified those who are more receptive to this notion of collaborative patient involvement, right? Patient engagement. And I worked with them. So that's one. There are others who see the benefit, and then they come on when they realize that patient advocates are not legal counsel or lawyers or people who are fighting for the cause. They are not the unions who are fighting, labor unions fighting for a cause.
So that's how receptive the healthcare folks are. If I'm going through chemo or am really trying to survive this disease, how receptive am I going to be to a perfect stranger? Because we know in meetings, sometimes you get in that meeting and the participants aren't receptive to you being there. So how receptive are patients to a patient advocate using facilitation skills?
So if the patient advocate dash facilitator is also a patient from within amongst them, as I am in the 3 groups that am in, I play the facilitator, but without declaring myself as a facilitator.
Right, right.
So they are having these meetings and all, and I use the skill sets and all. And they saw, so this is like my 6 years lived experience, right?
Right.
In combining the facilitation domain to the patient domain. And they saw that, the meetings were a bit different, the conversations were different, a bit more, if I may use the word structured, but I don't go structured with like, agenda, the way we do
Right.
deliverables and agenda and all, but roughly kind of nicely guided
Uh-huh.
from A to B, right? Point A to point B. And then they ask like, so why different? And then the conversation starts. So when I hear that, I hear it as an invitation to share about facilitation and process facilitation and what we do.
Nice.
So much so that out of the 3 support groups, one of them has now officially formed the patients themselves, the patient advocacy group, have now come forth to say, hey, can you teach us, share with us some of these techniques you're using? Because I told them it's not by accident that you experience what you just did.
Yeah.
It's deliberate, right? But I
Yeah.
didn't want to tell you how it's being done. I
Yeah.
just did it. And then now I've got some followers who are patients who want to learn this and they're
Nice.
practicing. So when they meet other patients and they use that, the usual skill sets, right, that we are used to. So that's my
Wow.
experience.
Well done. Um, I, you are so great as you sort of pass on knowledge and how great it is that all facilitators can help people experience something, and with any luck, they'll be better group members as well. In this world of patient advocacy, what are you finding as someone who's the patient advocate? What are some of the greatest challenges are that you have overcome? Let's just talk about you right now. If you want to throw in others, that's fine.
From a perspective of a patient advocate, but who is using facilitation skills and all, right?
Sure. What challenges are out there that you are typically overcoming? And now I know you know how to overcome them.
Yeah.
But,
Eileen, very interesting question, because I earlier just then spoke about, being in the patient group and then demonstrating to them how facilitation can be used without telling them I'm actually facilitating. And they're realizing there's some magic happening here, right? That's the patient advocacy group.
right.
It is also the clinicians and the healthcare providers, because the clinicians and healthcare providers, and I think this is quite conventional, traditional, think that patients are patients and that's all they can do. But must not forget that patients are also some kind of a professional in their own right. They are also parents, they are also
Right,
children.
right.
They are normal people with so many roles in their life. It's just that at that point in time, they have become patients as defined
Ah, good point.
for some kind of ailment or situation or condition.
Yeah,
But that doesn't mean that that's the only role. They have other roles, right?
yeah.
So likewise, like me, being a facilitator and I became a patient, I had that facilitator role and I was able to kind of use that together. So likewise, I think if the healthcare team, healthcare clinicians can also recognize that when they look at a patient, it's more than a patient. That person has also other lived experiences and roles that they play. How can we bring them into this entire,
Ooh, nice.
experience?
Yeah,
Yeah.
great. Thank you. Thank you for all of this information. And I know we only just kind of dusted over the surface. Excuse me. If anyone wanted to learn more about becoming a patient advocate, all those folks that are watching who are facilitators and know that they have those skills that could help, what can they do?
Thank you, Ellen. So first of all, I mean, in effect, right, the international body for facilitation, they could contact in effect, and I'm sure you'll be putting out the in effect contact
Absolutely.
information.
Yeah.
The other angle, or any other facilitation bodies that might be out there, right? And then there is also big movement from the perspective of patients and care recipients and all. So, they could find their nearest support group, or maybe they are already part of such a patient support group or advocacy group, and go talk to them and, be involved with them in that way. And hopefully, I'm hoping my personal wish is that, facilitators, as well as patients, caregivers, care providers, clinicians, so healthcare
Yeah.
stakeholders would all kind of come together
Mm.
to make this entire um,
Yeah. I
a
hope
patient
that too.
experience
Yeah.
a wonderful, although it's not so good news being declared a patient, but that it can also be still a pleasant experience, that journey.
That's right. That's right. Make the best of a very scary. Is that the best word? Frightening? I don't know. Bad? I don't even know the right words. And hopefully, that's one of the things that's shared in this world of being a patient advocate is the right words to use, right? So,
Yes,
uh,
lots of listening, lots of listening, lots of
oh,
empathy.
yeah, yeah. Prabhu, it has been such an important message, I believe, that you've shared here. And as always, it's just a delight talking with you. I'm in North America, you're in Singapore, and yet somehow it never seems that far away. So thank you, thank you, thank you for sharing your insights.
Thank you, Eileen, for giving me this opportunity.